What is regenerative anemia in veterinary medicine? Have you ever wondered how a pet's body responds when it loses red blood cells? This is where regenerative anemia comes into play. Regenerative anemia is a condition in veterinary medicine where the bone marrow reacts to a decrease in red blood cells by producing and releasing new, immature red blood cells into the bloodstream. This indicates that the bone marrow is functioning properly and trying to compensate for the loss of red blood cells. Anemia itself is defined as a reduction in the total number of circulating red blood cells, hemoglobin concentration, or packed cell volume. This reduction leads to a decreased ability of the blood to carry oxygen. If your pet is anemic, you might notice signs like pale gums, increased heart rate, weakness, or even low blood pressure. In cases of regenerative anemia, the bone marrow typically releases reticulocytes, which are immature red blood cells, into circulation. These reticulocytes are larger and contain less hemoglobin than mature red blood cells. This can lead to noticeable changes in blood indices, such as an increased mean corpuscular volume and a decreased mean corpuscular hemoglobin concentration. When a veterinarian examines a blood smear, the presence of these immature cells is a key indicator of regeneration. The most common causes of regenerative anemia in pets include blood loss and hemolysis, which is the destruction of red blood cells. Blood loss can be acute, such as from trauma or surgery, or chronic, like gastrointestinal bleeding or parasitic infestations. For example, hookworms in dogs or hemolysis in ruminants can lead to chronic blood loss. When blood loss occurs, the bone marrow typically responds within 3 to 5 days by ramping up red blood cell production to replace those that have been lost. Hemolysis can occur due to various factors, including immune-mediated hemolytic anemia, toxins, infections, or inherited diseases that cause premature destruction of red blood cells. In these cases, the bone marrow compensates by producing more red blood cells to replace those that are being destroyed. It is important to differentiate regenerative anemia from nonregenerative anemia, where the bone marrow does not respond adequately. Nonregenerative anemia may occur due to decreased erythropoietin production or abnormalities in the bone marrow itself. From a clinical pathology perspective, determining whether anemia is regenerative is the first step in diagnosing the underlying cause. This involves examining blood smears for immature red blood cells and measuring reticulocyte counts when possible. Understanding whether anemia is regenerative helps veterinarians identify causes like blood loss or hemolysis and decide on appropriate treatment strategies. Treatment may include addressing the source of bleeding, managing immune-mediated conditions, or providing supportive care like blood transfusions and fluid therapy. In summary, regenerative anemia in veterinary medicine is a condition where the bone marrow actively compensates for red blood cell loss or destruction by increasing production. This condition is commonly associated with blood loss or hemolytic processes. Recognizing regenerative anemia is essential for accurate diagnosis and effective management of affected pets.